What is the Florida campaign's main goal in plain language?
Our first goal in Florida is to end amalgam in Medicaid, in Florida Medicaid. The shift in dentistry has been good for many of us. Many of us are no longer getting mercury-based fillings, but we're leaving behind the powerless and the poor, our soldiers and sailors, folks on Medicaid, in U.S. Indian Health Service, and Indians on tribal lands, veterans, the administration, those that are the prisons, those in institutions. So we've got to do that. So our focus right now is Medicaid. Our bigger goal is to implement what Surgeon General Ladapo called for, which is the end of use of dental amalgam in Florida because of the exposure to mercury. That's the big goal, the final goal.
Why did you choose Florida as a model state, and what makes it winnable right now?
Well, the presence of Surgeon General Ladapo was a big factor. Nigerian-born, great success story, Harvard Medical School, professor at UCLA, then called on by the governor to come to Florida and lead a new kind of Florida health. That was a big factor. I think Florida has many open-minded people. It's innovative. Florida started the sunshine laws, for example, years ago. That's why they're called sunshine laws, open meetings laws, because Florida's the sunshine state. And Florida's been innovative, wants to be first in health, and here's its chance to be first in dental health.
What specific policy change are you pushing for in Florida, and what would it change in practice?
What we need to do is recognize that no one should get mercury amalgam, starting with children. No child should get that. The U.S. Food and Drug Administration says that. Rich or poor, no child should get amalgam. No pregnant woman, breastfeeding woman, or young women who might choose at some point to become pregnant. So we simply have got to protect today's children and future children by ending amalgam with children and with young women, all of them across the board. And that includes Medicaid, that includes our servicemen and women, anybody institutionalized in prisons, mental schools, the schools that Florida have for the blind and deaf, the county health programs, all these programs that we serve, if you will, the poor and the powerless, those that aren't really able to make decisions, that aren't empowered. Most of us are. Most of us can walk in a dental office and say, don't give me amalgam. And I urge everybody within the sound of my voice to go to their dentist, and don't let a dentist talk you into mercury fillings. Don't let them tell you it's silver. It's not silver. It's not silver. Dentistry has fooled us. They fooled us, and they should be ashamed of themselves. Any dentist that has called this silver. The progressive, the thoughtful, the modern dentist doesn't use mercury fillings. But we have an old guard that doesn't really care about their workforce. That is the danger in the clinic, the danger to the patients, the impact on themselves, and therefore consumers have to demand change. But unfortunately, prisoners, soldiers and sailors, people on Medicaid are just powerless to make their own decisions. It's not fair, so we've got to intervene and help them.
Who are the key decision makers or institutions in Florida that can move this forward?
Yes, there are key decision makers. The head of the prison system in Florida should end amalgam. The head of the Medicaid system, Brian Meyer, should end amalgam in use. Surgeon General Ladapo can end amalgam use in the county health departments, which are run by Florida Health. They have ended it in large part, but it is continuing to some extent. So there are key decision makers there. We certainly welcome help from our state legislators that would be interested. We certainly are so pleased to have help as well from the Florida public.
What are the biggest barriers in Florida, and how are you working around them?
Well, the biggest barrier is the Florida Dental Association. It's pro-mercury. It's tied in by a chained membership to the American Dental Association, the voice, if you will, to keep putting mercury in people's mouths, the big lobby group, pretty shameful lobby group, because they're a patent holder and they are not for modern dentistry, they're for mercury. They have finally conceded that amalgam needs to end, but they want to think it should end over 8 years, and we think it should end over 8 months.
What has been the most effective argument in Florida so far? Consumer choice, environmental impact, modernization, or cost?
Amalgam is an environmental disaster. That is what has been most effective on the international stage. That's why the Minamata Convention on Mercury, it is now put into international law and into the amalgam trade 7-8 years from now, but it will end. That's environmental. Place is important. The dental hygienists, the others that are injured. Remember, mercury is the most vaporous of the heavy metals, which means that those vapors are coming into the clinic, poisoning the clinic, poisoning the people who work in clinics, including young women who might be pregnant or become pregnant or maybe breastfeeding. And that's it can be a disaster, a lifetime disaster. It's horrible to say, to the mercury damaged child. So workplace is important. Cost is important because the taxpayers are picking up the cost of the environmental damage. The dentists are so disinterested in the taxpayers. They are polluting the waters of Florida, the Lake Okeechobee and the rivers of Florida, the bays, the Tampa Bay and other bays, and so Jacksonville River and so on. And that should stop because either it poisons us, poisons the people that eat the fish, or it requires the taxpayers to pick up the cost. So cost argues strongly to end amalgam. And then finally, health. Health is correct. The Food and Drug Administration said lots of people should not get amalgam. Besides the children and young women, they include those with kidney disease, and dentists can't diagnose kidney disease. Many people have them, much more common among Black men than among other demographic groups. And that's important too, because they're more likely, children of color, men and women of color are more likely to get amalgam still. And neurological disease, neurologically damaged people, those with neurological conditions should not get amalgam. And those as well with metal hypersensitivity issues. So all those reasons mean we shouldn't get them. So your question's the right one. What are the reasons to end amalgam? And the list is quite long.
Would winning in Florida unlock for other states?
It's the prototype. Florida is the prototype state. We picked Florida and we picked Rhode Island, big state, small state, from the south, from the north. We want to make sure we are trying to find states that we can win in, because as one Supreme Court Justice, Justice Brandeis, wrote, the states are laboratories of democracy. Things succeed first in the states. We try them out. If they really work, we take them to other states or we take them to Washington.
What are the top strategies that have actually reduced amalgam placement in real-world campaigns?
The strategy of the environment, and I want to credit my wife Ann Swanson for telling me, start talking about the environment. That's your winning hand. And it certainly was at the Minamata Convention, because at the Minamata Convention, the 6th Conference of the Parties on 7 November of 2025, the nations of the world agreed that the amalgam trade must end. No more making, no more importing, no more exporting of mercury-based dental fillings, which is called amalgam. The end date is 2034. It's hard to get an early end date, but the point was when we started, we were told amalgam will always be there, and it's not going to always be there. We will end it. There is an end date. Now we have to have an end date of use, and 2034 is far too long to wait. That can end one at a time by the consumer moving it. So the environment strategy worked. Credit my wife pushing that issue on me. The consumer choice issue works well. Demand your choice. Demand mercury-free dentistry. The health issue works well. Putting mercury, exposing anyone to mercury is a virulent neurotoxin. It's a virulent reproductive toxin. It gets in the fish, causes brain damage in children. It does, but brain damage in children. It should never be used. So we have the arguments on health, we have the argument on environment, we have the argument on consumer choice. We brought them all together and we scored a big win internationally. Now we want to bring it home to America.
What strategy tends to fail or waste time, even if it sounds good on paper?
Well, we started by victims being front and center, and that did not work. We started with litigation against the Dental Association. Litigation was not a very good strategy if you don't have a ground game, if there's nothing that the judges can see as important beyond the courtroom. We had to recognize the limits of lobbying, the limits of legislation. We did get some state laws passed, but that stopped pretty soon. So we certainly ran into dead ends. We accepted dead ends, and we just shifted gears to strategies that could work.
What policy design features prevent loopholes and backsliding after a win?
It is true. You get a decision that you think would end amalgam, and then they say there's loopholes. Right now in Florida, Surgeon General Latipo has courageously stepped forward and said, stop amalgam use because of mercury exposure in routine fillings. While a dentist told me This week, there's lots of fillings that aren't routine, so the amalgam needs to continue beyond what anyone would expect. We can't allow that kind of thinking to say, well, it's anything routine, so anytime you want to use amalgam, call it not routine. Dentists have done this for a long time. It's an incredible historical mistake. It should have been corrected by the profession. The profession failed. The dental profession failed the American people. The American Dental Association is a patent holder on amalgam. They dug in their heels instead of modernizing their profession. They wanted to keep the profession in this 19th century primitive, pre-Civil War pollutant. They look for loopholes. We have to close those loopholes, and one way we close them is to cut off the market. Just that you can't find it, and someday you can't find it because the amalgam trade is going to end.
How do you counter the amalgam is necessary narrative without getting pulled into technical debates?
It's a big issue, and it is a problem when dentists say, I'm a dentist, I know more than you. We have to accept the point that health professions and experts are, in their narrow fields, know a lot, but are not looking at the big picture. We have to accept as well that many professions have their own self-interest, and frankly, who doesn't? But we have to recognize they are talking their self-interest, and their self-interest is the status quo, and the status quo is not acceptable. Mercury-based dental fillings are not acceptable. So Mark Twain said it's hard to convince somebody of your argument if their economic situation depends on the alternative. And the alternative for them is a nice, comfortable living, placing mercury fillings in poor people, running the Medicaid mills, for example, or having a government job where you just place the amalgam and then get to the golf course at 3 o'clock. So we have to recognize and stand up to dentistry just like you stand up to anybody else. I'm a lawyer. People need to stand up to us when we're wrong. We're wrong a lot. Many lawyers think they're not, but they're wrong to say they're not wrong. And so I think it's important we recognize that dentistry has committed a huge error, and it's been the public that's had to step in. And we've led this fight. Consumers for Dental Choice has led this fight all through this country to change dentistry, and we're well on the way to winning.
If you could change one lever nationwide to speed the phase out, what would it be? Coverage rules, procurement standards, disclosures, or something else?
Change the coverage rules. Disclosure doesn't seem to work because the dentists that use amalgam countermand their own disclosures or don't give them at all. Insurance is equally shameful, and even after the Food and Drug Administration issued its decision to say that amalgam shouldn't be used on children, to the great credit of the product makers in America, Dent Supply and Invista, they stopped making amalgam. The two major companies stopped making amalgam. That's to their huge credit. But insurance didn't change. The insurance company said, we don't care. So FDA says, don't give amalgam to children. And the insurance companies say, you have to pay a penalty if you don't want amalgam in your child. You can have amalgam under your insurance policy, but you have to pay a penalty if you don't want it. If you're pregnant, you have to pay a penalty. It's outrageous. The insurance companies didn't change, and industry did change, but insurance didn't change. So coverage rules are huge. Florida, all the states should change their insurance policies. New York, California, Texas, every state should step up and say to the dental insurance companies, you may no longer cover amalgam. You cover the others, and if the dentists aren't getting paid for amalgam, they're not going to use amalgam.
What does a strong mercury-free default policy look like?
It's mercury-free dentistry, period. There's not also, you don't put arsenic in the mouth, you don't put lead in the mouth, you don't put mercury in the mouth. Simply say that is not an acceptable material, and dental boards could tell them that, insurance companies could, Food and Drug Administration's done a lot, they could do more. It could come down to the individual dentist. The individual dentists have got to decide not to do it. But if not, if they don't see the light, then they should feel the heat. And consumers should say, you can't be my dentist. If you don't give amalgam to me, I don't want amalgam, but if you're giving amalgam to that welfare child too, I'm not going to go to you as a dentist. I'm not going to go to you, dentist, if you use amalgam on anybody. I will pack up my bags under consumer choice, and I will go from Dr. Smith to Dr. Jones because she is mercury-free, and that's where I'm going to go.
What should consumers know about their right to choose mercury-free materials as a default preference?
Yes, mercury-free needs to be the one and only option in the future, and that could include composite, it could include resin. There's several different choices. Prices vary on them, longevity and all those factors. They are the white colored fillings, the tooth colored fillings. The tooth colored fillings is what you want. The gray colored fillings you don't want, they're mercury. There are dentists who still use amalgam, will try to talk you into it, perhaps because they just want to do it, just spend less time on you, the patient, and get on to the next patient and make more money faster. And it's just not acceptable. It's just not acceptable for you, for your child, for your family member, for anyone to continue with amalgam. The time is up. The world has decided they need to go. The Food and Drug Administration has asked that they go. And frankly, dentists should stop, but they won't stop. So you, the patient, you, the consumer, you, the parent, have got to say enough is enough.
What are the most effective non-medical actions a consumer can take to support mercury-free dentistry at the community level?
That's a real good question. I think we can do more. One is to ask your dentist, have you stopped using dental amalgam? Have you stopped using dental amalgam? Another would be to phone the other dentists in the community. Just say, I'm looking for a dentist. Have you stopped using dental amalgam? Regardless of the question, at least they know consumers in the community don't want this stuff anymore. So just do a quick phone survey. So talk to your dentist, do a phone survey, and third, just tell the community, tell your network, mercury-free dentistry only. And this is for the benefit of your health, and this is for the benefit of not having mercury in our fish and in our food.
What should consumers look for in a clinic's public messaging or paperwork that signals mercury-free is truly the default?
Well, you look for things where they're calling amalgam silver fillings. That's a deception created or pushed forward by the pro-mercury American Dental Association to try to keep the use of mercury. They are patent holders on amalgam, and they promoted them as silver. They knew it was a lie. It is a lie. They're not silver. They're twice as much mercury as silver. And so if it has twice as much of one, you shouldn't give the second one in the list. Or they could have called them mercury silver, but they didn't. So any dentist calling this silver fillings, get the heck out of the office. That dentist is not for you.
What kinds of transparency requirements, disclosures, signage, consent language make the biggest difference for consumer choice?
Well, first would be just awareness when you walk in the office. If the dentist is not going to get that information, do it. But if the dentist is disclosing to you that this is mercury, I think that should be enough for us. Mercury is toxic. We all know that. It is not only the most toxic of the heavy metals, it is the most vaporous, which means that when it's in the mouth, the vapors continue to come off. They go to the brain, they go to the placenta, they go to places that cause permanent damage to us. So we simply should not let mercury into our bodies any more than we want lead or arsenic or other materials. And this is not a small amount. There's as much mercury in a dental filling as there is in a thermometer. And we can look at a thermometer and we can see how much it is. It's like half a gram. It's a lot.
What are the simplest ways people can push for mercury-free options in insurance and benefits without needing any clinical conversation?
Well, first, if you have any role in negotiating, if it's a company plan, negotiate mercury-free for every employee. So one would be if you're within a company plan, go to whoever's in charge of the dental policy and say, don't do this. We want mercury-free. We don't want amalgam at all, but at the least we don't want to pay for the alternatives. Take amalgam off the list, first choice. Second choice is the alternative should be at the same price, and we shouldn't pay a penalty. We shouldn't pay a penalty for safety. So that's a big factor. In terms of insurance, we certainly welcome you in our coalition to change the insurance policies of America. And please do write us. Write us at Consumers for Dental Choice. Email me, charlie@toxicteeth.org, charlie@toxicteeth.org, and tell us you want to be part of the coalition to change insurance policies in America so that health insurance does not cover mercury fillings.
How can parents and community groups advocate for mercury-free standards in schools, public programs, and local health systems?
It's really important in the schools. Go to the PTAs, go to the school principal. Don't let these dentists into the schools to place mercury in children. Don't let them in. Tell the principal this is not acceptable to come into schools, and they do this particularly in inner cities. Don't just tell the dentist they cannot use mercury-free dentistry in this school or in their vans or in their clinics or anywhere else. The children of this school should not get mercury-free dentistry. Talk to the PTA, talk to the parents groups. As a teacher, ask the principal. Some of our viewers today are teachers or school service personnel. So please be engaged to keep mercury fillings out of your schools and out of reach of the children that go to this school.
What are the highest impact actions supporters can take to help the Florida campaign specifically?
Our priority now is for the low-income families of Florida on Medicaid. Some families can't make it without help, and their health care bills are so large we need Medicaid. We need to have Medicaid. But families on Medicaid should not be getting mercury fillings. They're not bottom of the barrel people. They have the same family, a love for their family, the same participation as good family members, and they deserve mercury-free dentistry. So I would urge Florida Medicaid to stop using amalgam, and you can help. Please write Brian Meyer. Brian is a very capable and excellent civil servant. He is the Assistant Secretary for Medicaid of the Florida Agency for Healthcare Administration. And on the screen will be Brian Meyer's email. Please write him and say, I'll proceed, Assistant Secretary Meyer, call Mr. Meyer or Assistant Secretary Meyer, with ending amalgam in Medicaid for Florida families.
What kind of supporter stories or local examples help most in Florida? Environment, kids, consumer choice, fairness.
Fairness is really important. We still find that children of color are more likely to get amalgam fillings. We still find that powerless consumers, our soldiers and our sailors, the people and our airmen, our Marines and their families, the people who are asking to make ultimate sacrifices for the safety and security of the United States of America overseas. And we're telling them, too bad, you get mercury fillings. That's just not fair at all. It is not fair to those who are institutionalized. It's not fair to low-income families. It's certainly not fair to Native Americans on tribal lands. But I can say that one is ending. To the great credit of Secretary Robert Kennedy in Washington, the Secretary has ended amalgam for Indians on tribal lands effective in 2027. We can copy that for Florida institutions. We can copy that for Florida state schools and county schools. We can copy that for Florida health programs. The public programs now have a role model, which is no amalgam, which is true in the Indian Health Service, and it can be true in all public programs in Washington, in Sacramento, in Austin, in Albany, in Tallahassee, in Columbus, in Harrisburg, in Lansing, in Madison, in all the state capitals of America. We should demand the end to dental amalgam in state government programs.
What does helping you win look like in a realistic week for a supporter with limited time?
Limited time would be to write Brian Meyer of Florida Medicaid if you're a Floridian. If you're a Californian, write me. If you're a New Yorker, you're a Texan. You're from the Midwest, you're from the South, you're from the Rocky Mountains, you're from New England, you're from the West, you're from the Midwest, the Southwest. Write me. I'll tell you who you can write in your state Medicaid program, charlie@toxicteeth.org. We'd love to have your help and your contact point to say, in my state, we should end the use of dental amalgam for the low-income families in our state.
What milestones should supporters watch for to know the campaign is gaining traction?
When the mercury-free dentists take over dentistry, when the American Dental Association ends as a pro-mercury organization and recognizes that dentistry should close the chapter, the ignominious chapter, if you will, of the amalgam era.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.